in this particular area here, the patient has a little bit of loose and lax skin. She's already received a treatment with our radio frequency. It's a non-invasive device which basically stimulates through the radio frequency electrical currents the inductive mechanism of increasing collagen and elastin formation in the skin. The particular mode that we'll use here will penetrate the full depth of the skin as well as get into the fatty area as well. Now, people who have lost weight, maybe even people who have had liposuction that still have a component of loose and lax skin, even these stretch marks here, are helped by this modality because increasing the collagen and elastin formation in that skin makes it not only a little bit more elastic, makes it a little bit tighter, makes it a little bit more resilient. This particular treatment requires that we put a little bit of a contact solution, it's nothing more than glycerin, in the area that we're going to treat. This provides a good contact measure for our electrodes and electrical current, and it operates through a mechanism of suction which makes contact with those electrodes so that electrical current remains constant and predictive. Now, the patients that undergo this usually undergo 4 to 6 treatment sessions, maybe as many as 8. You do it about every 2 weeks. Sometimes a week apart is what we do, for areas that are particularly loose and lax. A maintenance kind of procedure with this is also something that we do every 3 to 6 months in order to maintain the best tone to the skin. Now, this suction device here and this firing mechanism creates that little red area, very much like the vacuum cleaner goes. And you can see it. We'll overlap the area a little bit. And the first part of the mechanism here is warming the skin up. We know we took a baseline temperature of about 30 degrees with our temperature probe. And we'll see the skin heat up over time, and then we'll go to the treatment mode, which increases the depth and penetration of our electrical current. Are you comfortable there, Kelly?
Yeah.
There's very little, if any, discomfort associated with this. We can adjust some of the energy level if that's necessary, if the patient becomes uncomfortable, but no anesthesia is even required. There's not going to be any downtime. The patient will be able to head back to the gym if she wants to, even this evening, if she worked out. We recommend that you drink plenty of fluid. It's part of that inductive mechanism. The body's going to react to this in an inflammatory fashion. And that inflammatory fashion is actually beneficial in this particular case. And we'll take a real quick temperature probe here, as I said, as we're trying to get things up to temp. And we're there. So what we'll do is we'll dial in the treatment time in the protocol. We find it's about a 14-minute treatment time that we'll go through, and the machine will tell us when we've arrived at that, and it'll have delivered the protocol energy that we know to be beneficial and helping tighten the skin up. Now, following weight loss procedures and extreme weight loss, this may be an alternative to a surgical procedure. It's not that everybody reacts and not everybody's skin that will gear up to the same extent, from one patient to another, but the results can be quite remarkable and impressive. And avoiding a surgical procedure in cases when it's not necessary, of course, is desirable, but it's a modality that we can use in an additive fashion for our patients with liposuction. What we're doing is providing a continuum of care here at Bednar Cosmetic Surgery, and the reason for that is that the surgical options provide tremendous value to a patient, but it's not always indicated at particular times in people's lives or particular type of lifestyle, how busy life may be for them at that time. And they know that we can offer them something of scientific value, of proven efficacy, value for their dollar, in an additive and adjunctive fashion. We've got another 4 minutes left, but not too much longer.
Yeah, it's relaxing.